Have you ever wondered why some people recover almost completely after a stroke, while others are left with permanent disability? The difference is often not luck. It is how quickly the warning signs are recognized and treated. Many people imagine a stroke as someone suddenly collapsing to the ground, but real life is often much quieter than that. A person may simply begin speaking strangely, lose vision in one eye, struggle to hold a cup, or suddenly feel off balance. Because these symptoms can seem harmless at first, valuable time is often lost. Every minute matters during a stroke because brain cells begin to die when they are deprived of oxygen. The faster blood flow is restored, the better the chances of saving brain tissue and reducing long-term damage. That is why understanding the symptoms of stroke is one of the most important pieces of health knowledge anyone can have. To understand the symptoms, it helps to understand what a stroke actually is. A stroke occurs when blood flow to part of the brain suddenly stops or when a blood vessel inside the brain bursts. About 85% of strokes are ischemic, meaning a blood clot blocks an artery supplying the brain. The remaining cases are hemorrhagic strokes, where bleeding damages brain tissue and increases pressure inside the skull. Although the causes are different, the result is the same. Brain cells lose their supply of oxygen and nutrients. Since different areas of the brain control different functions, the symptoms vary depending on which part of the brain is affected. This explains why one person may lose the ability to speak, while another suddenly cannot see clearly or maintain balance. The first and most recognized symptom is sudden weakness on one side of the body. This weakness may affect the face, arm, leg, or all three at the same time. It usually occurs on only one side because each side of the brain controls the opposite side of the body. Someone who was carrying groceries a moment ago may suddenly find that one arm feels unusually heavy or impossible to lift. This is one of the strongest and most reliable warning signs of stroke, supported by decades of clinical research. Closely related to weakness is facial drooping. If a person is asked to smile, one side of the face may remain still while the other moves normally. Sometimes the drooping is obvious, but in many cases, it is surprisingly subtle. Family members often notice that the person's smile looks uneven or that one corner of the mouth appears lower than usual. This simple observation forms part of the widely used FAST test because it is easy for anyone to recognize. Another important symptom is arm drift. When both arms are raised at shoulder height, one arm may slowly drift downward, even though the person believes both arms are being held equally. This happens because the damaged brain can no longer send normal signals to the muscles. It is a simple but effective way healthcare providers check for stroke-related weakness. Not every stroke causes weakness. Some strokes mainly affect sensation, producing sudden numbness or tingling, usually on one side of the body. Unlike the temporary numbness that occurs after sitting awkwardly, stroke-related numbness appears suddenly, without an obvious reason, and often involves the face, arm, or leg together. Loss of coordination is another important symptom. A person may suddenly become clumsy, struggle to button a shirt, miss objects while reaching, or find that simple movements no longer feel smooth. When the cerebellum, the part of the brain responsible for coordination, is affected, movements become inaccurate even if muscle strength remains normal. Difficulty walking often accompanies this loss of coordination. Someone may stagger, sway from side to side, or appear intoxicated despite having consumed no alcohol. Family members sometimes mistake this for fatigue or dizziness, but a sudden change in walking ability should never be ignored. Speaking of dizziness, it is important to separate ordinary dizziness from stroke-related dizziness. Millions of people experience dizziness due to dehydration, inner ear problems, or standing up too quickly. However, sudden severe dizziness combined with other neurological symptoms such as double vision, difficulty speaking, or loss of balance may indicate a stroke affecting the back part of the brain. This is one reason why doctors look at the whole pattern of symptoms rather than focusing on a single complaint. Speech problems are among the most alarming stroke symptoms. Some people develop slurred speech because the muscles involved in speaking become weak. Their words may sound mumbled or difficult to understand. Others experience something more complex. They know exactly what they want to say, but cannot find the right words. This condition, known as expressive aphasia, occurs when language-producing areas of the brain are damaged. In other cases, people can speak fluently, but no longer understand what others are saying. They may answer questions with unrelated responses while believing they are communicating normally. This is called receptive aphasia and demonstrates how strokes can affect different language networks within the brain. Sudden confusion is another warning sign that is frequently overlooked. Family members often notice changes before the affected person does. Someone who was thinking clearly a few minutes earlier may suddenly become disoriented, forget familiar information, or struggle to recognize people around them. Because confusion has many possible causes, it is sometimes dismissed, but when it appears suddenly, stroke should always be considered. Reading and writing can also be affected. A person who reads every day may suddenly find that words no longer make sense, even though their eyesight is normal. Others may discover they cannot write a simple sentence or even sign their own name. These symptoms reflect damage to specialized language centers in the brain rather than problems with the eyes or hands themselves. Difficulty swallowing is another symptom that many people do not associate with stroke. Swallowing is controlled by a complex network of muscles and nerves coordinated by the brain. When this system is disrupted, food or liquids may enter the airway instead of the stomach, increasing the risk of choking and serious lung infections such as aspiration pneumonia. This is why hospitals carefully assess swallowing ability before allowing stroke patients to eat or drink. Some people report overwhelming fatigue around the time of a stroke. While this is not considered one of the classic warning signs, research suggests that unusual exhaustion may occur in some individuals, particularly women. The evidence is less consistent than for weakness or speech problems, so fatigue alone does not confirm a stroke, but when it appears suddenly alongside other neurological symptoms, it deserves immediate attention. Vision changes can also provide important clues. A stroke may suddenly block vision in one eye or cause the loss of half the visual field. Some people assume their glasses are dirty or that their eyesight has simply become blurry, but the real problem lies within the brain's visual pathways. Others experience double vision because the nerves controlling eye movements are no longer working together properly. Sudden vision changes should always be treated as a medical emergency, especially when accompanied by other stroke symptoms. One symptom that receives a great deal of attention is the sudden severe headache, often described as the worst headache of a person's life. This type of headache is especially concerning for hemorrhagic stroke, where bleeding inside the brain rapidly increases pressure. Not every severe headache indicates a stroke, but when it begins suddenly and is unlike any previous headache, urgent medical evaluation is essential. Nausea and vomiting can also occur, particularly when strokes affect the brainstem or cerebellum. Unfortunately, these symptoms are easily mistaken for food poisoning or a stomach virus. The key difference is that stroke-related nausea is often accompanied by balance problems, vision changes, weakness, or other neurological symptoms. In more severe cases, a stroke may cause loss of consciousness. This usually occurs when a large area of the brain is affected or when bleeding creates significant pressure inside the skull. Someone who suddenly becomes unconscious should receive emergency medical care without delay. Although less common, seizures can sometimes be the first sign of a stroke, especially hemorrhagic strokes. A seizure in someone with no previous history should always prompt immediate medical evaluation because it may indicate a serious underlying neurological emergency. One of the biggest misconceptions about stroke is that every symptom must appear together. In reality, many people experience only one or two warning signs. Someone may have sudden vision loss without weakness. Another person may only develop slurred speech. Someone else may simply lose balance while walking. Waiting for additional symptoms to appear can waste precious time. Another misunderstanding is that strokes are always painful. In fact, most ischemic strokes cause no pain at all. The brain itself lacks pain receptors, so a person may lose movement or speech without feeling any physical pain. Healthcare professionals often teach the FAST method to help the public recognize stroke quickly. FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. Many experts now recommend the expanded Be Fast approach, which adds balance problems and eye or vision changes before the original FAST signs. This expanded version helps identify strokes that affect the back of the brain, where balance and vision problems may appear before weakness. If you suspect someone is having a stroke, the most important action is to call emergency medical services immediately. Do not wait to see if the symptoms improve because temporary improvement does not guarantee safety. Treatments that dissolve blood clots or physically remove them work best when given as early as possible. If you can, note the exact time when symptoms first began or when the person was last seen acting normally, as this information helps doctors decide which treatments are appropriate. Do not give food, drinks, or medications because swallowing may be impaired, increasing the risk of choking. While today's focus is recognizing symptoms, prevention deserves equal attention. Strong scientific evidence consistently shows that controlling high blood pressure is the single most effective way to reduce stroke risk. Managing diabetes, lowering high cholesterol when recommended by a healthcare professional, avoiding tobacco, staying physically active, maintaining a healthy weight, treating heart rhythm disorders such as atrial fibrillation, and taking prescribed medications as directed all play important roles. Despite many claims online, no herbal remedy, detox, or dietary supplement has been proven to replace these evidence-based prevention strategies. Certain groups should be particularly alert to stroke symptoms. People with high blood pressure, diabetes, high cholesterol, heart disease, atrial fibrillation, obesity, or a previous stroke have a significantly higher risk. Smoking and excessive alcohol use also increase risk. Age remains an important factor, but it is equally important to understand that strokes can occur in younger adults and even children under certain circumstances. Because many people believe stroke only affects the elderly, symptoms in younger individuals are sometimes overlooked, delaying life-saving treatment. The most important lesson is that stroke is defined not by one specific symptom, but by the sudden loss of normal brain function. Whether the first sign is weakness, numbness, vision loss, speech difficulty, confusion, dizziness, loss of coordination, or a severe headache, the key word is sudden. Recognizing that pattern and acting immediately can make the difference between recovery and permanent disability. Remember the simple phrase, be fast. Balance, eyes, face, arm, speech, time. It takes only a few seconds to remember, but one day it could help save a life, perhaps even your own or that of someone you love.